Hello, and thank you. I am so gratified by the work you do every day to make sure that we can continue to provide the best possible care and support for our patients and families at a time when our whole worlds are being turned upside down. In the face of all of the constant change and uncertainty that COVID-19 is bringing, you are demonstrating incredible courage and calm and compassion. And most of all, you're doing what you do best. You're putting kids first. For all of us, this is a very anxious and unsettled time. And in the face of that kind of uncertainty about the future, it would be easy to just hunker down and freeze up. But as daunting as it is, we really need to be looking ahead. We need to be looking forward. As the Reverend Dr. Martin Luther King Jr. said, he said, "If you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. But whatever you do, you must keep moving forward." And Children's Minnesota is moving forward. I want to share with you a couple of examples of that, a couple of stories that illustrate teams that are joining together and owning outcomes and being remarkable. Now, the first example, as you know, the COVID-19 pandemic has created a real shortage of our personal protective equipment. Healthcare organizations nationally are having trouble getting our usual supplies through our normal channels. And face shields, which provide eye protection for staff who are dealing with suspected or known COVID-19 patients, are in particularly high demand. So that's where remarkable people like John Hendricks, our biomedical engineering manager, came in. John thought maybe Children's Minnesota could manufacture the face shields itself. So he pulled together a team and they developed a process for manufacturing reusable face shields. They got some of the materials they needed from own supplies and also from a variety of local stores. And that was thanks to the help of our Children's Minnesota courier team. They went around and they hit up every retailer they could on their routes to get the materials they needed. Now, the team went into production expecting to make about 1,000 masks a week. But on the very first day, they made 295. And then we put an article about it out on StarNet, and more employees stepped forward to volunteer their time and to ramp that up. It's a great example of thinking creatively to problem solve and to look forward. Our second example is ramping up our telehealth services, or some people refer to it as virtual care. Now, in virtual care, patients and families connect, instead of coming in person, they connect via video with their healthcare team. And the patients and the providers can see and hear and talk to each other just like they do in an in-person visit, but it allows us to provide care even in the face of social distancing and PPE shortages. Now, we've had to really aggressively ramp up our telehealth services. We went from 0 to 60 in record time. Large team came together to pull together the necessary technical and other infrastructure to train providers, to reach out to patients and families to make it all work. And it was a dramatic success. In just the first 8 days of April, we had 720 virtual care encounters, compared with 74 in the entire month of January. It is another great example of teams just coming together and making things happen in a remarkable way. I think these are both terrific examples of the power of our values. They really illustrate amazing in action. Now, managing through this COVID pandemic is not easy, and it is not fun, but it is doable. And I think these examples demonstrate that by joining together, we will get through this together. We will get through this together. Thank you.